Now I would like to call in on stage for a keynote about the future of healthcare. Please welcome His Excellency Ghassan Hasbani, Deputy Prime Minister, Ministry of Public Health, Lebanon.
Good morning, everyone. It's always a pleasure to be back in the telecoms world, and especially in this particular event that's dear to my heart, with Trace Media and Tony Aid in particular. So we're all proud of what's being done here. And year after year, we find new ideas, new concepts being discussed within an old industry. Yes, indeed, our industry is one of those who have actually aged. It's no longer the new stuff. Case in point is what I'm going to be talking to you about today. In my humble experience of 2 years as a Minister of Public Health, I had a very fast learning curve in the healthcare sector. Yet I discovered that technology, communications, and non-communications technologies were at the heart of that sector, contrary to my previous beliefs. And over the next 15 minutes or so, I'm going to share with you a sneak peek of how technology in all its forms will be shaping healthcare in the future. And I'm not going to be talking about the actual industry structure and operations, because that will be also tackled a bit later in the panel. I'll be talking about health in general and how technology has been and will be influencing it. We've heard so far a lot about the fourth industrial revolution, so I will not dwell too much on that. In 1784, we had the first industrial revolution based on the steam engine, mechanical production, and industry. In 1870, almost 100 years later, we had the second revolution based on the division of labor, electricity, and mass production. In 1969, again, almost 100 years later, we had electronics, technology, IT, automated production, and of course, the internet, and now the Internet of Things. That third revolution, not many people spoke about it as a revolution because we kind of lived it, and we are from the era of the creation of that revolution, most of the people in this room, with the exception of a few who preceded that era. That led us now, is actually leading us to the fourth industrial revolution of tomorrow, which is at the cyber system level. It is characterized by velocity, because change is happening now at an exponential pace, assisted by the previous revolution. So we will not be waiting 100 years. And as you noticed, since the 70s until now, we've had the third phase, and now we're entering the fourth revolution. So we didn't actually wait 100 years to trigger the fourth revolution. The scope is very wide. It's disrupting almost every industry in every country, in every part of the world, whether developed or developing. And the impact is happening at system level, so it's a transformational impact of entire systems of production, management, maintenance, and governance. There are several vectors and there are several trends making up the vectors of the upcoming change. Materials science, robotics, and here I say materials again, nanotechnology, biotechnology, and 3D printing. We'll take them one by one. I'm not going to recite the entire history, as I promised, Marwan particularly. But I will pick a few points in the history of the evolution of every one of those trends and vectors. Artificial intelligence, the concept started back in 1939 with the first robot being displayed at the World Fair. And mankind had different ideas about what robots would look like and what robots would actually do. By 2010, IBM Watson defeats Jeopardy contestants with its knowledge in artificial intelligence. 2018, this year, we have robots routine or carrying routine surgery or routinely carrying certain surgeries. By 2030, we will have robots capable of performing at human level in most manual jobs. So, will robots replace humans? I wouldn't say so. Robots are there to enhance the capabilities of humans to perform certain tasks. Maybe they will replace them in small, mundane tasks so that humans can actually focus on performing more complex thinking that requires more imagination and more linkages and more humanity, while robots do the simple stuff and assist humans in performing their jobs as tools. So we have enhanced operations in human control robotic tools. So medical operations would be better, would be enhanced. Would they be left completely for a robot to perform on its own? Perhaps not. But they will be, for sure, enhancing the quality of operations by assisting humans to do them more accurately. They will coexist with humans in many aspects of life, labor, of life and labor in particular. As I mentioned, artificial intelligence-assisted operations, whether robotics are involved or not, will become more of the norm and started to become already part of advanced medical treatment. So basically, you get better diagnosis, better visibility on the insides of a human body, and better planning for operations and better performing of operations, where artificial intelligence assists physicians in identifying certain areas and improving certain techniques within the operation. The market for this in 2020 is expected to be around $75 billion US. This is challenging human creativity and savoir-faire, because this is where humans now have to evolve their engagement to a higher level than the basics they're used to. 3D printing, we mentioned it as also a key trend. In 1984, that technology was developed for the first time. It was bulky, extremely expensive, very limited. Mass production happened by 2016. By 2030 to 2050, we expect to have complete products that are 3D printed. This is digitizing matter, enabling us to manufacture whole products, allowing user-personalized and immediate prints wherever we are on the desk. An expected market of $22 billion in 2020. This is expanding to cover healthcare, avionics, cars, as well as other manufacturing fields. And we'll get back to this a bit later with the applications in healthcare. The development of biotechnology and DNA decoding will enable the creation of new materials for human body parts as well as industry. As we have seen, this has been worked on since the 1800s, but development has accelerated in the last few decades and is exponential. The first full DNA decoding happened at the turn of the century, this 21st century. Personalized medicine is likely to be mainstream by 2015. This is basically today. For certain patients of chronic disease or cancer, with a simple DNA test, it is possible to pinpoint the medical composition and molecules for treatment that pinpoint and target that cancer specifically and are most effective against that cancer. reducing the cost of cancer treatment by 40%, and improving the chances of 5-year-plus survival rate by a significant amount, exceeding 85% for complex cancers and 100% cure for simpler ones. By 2040, major breakthroughs are forecasted to be achieved in resolving genetic disease in adults. So this is basically changing and modifying the genetic codes of people to eliminate genetic diseases, diabetes, heart, and other things. This will enhance the human well-being significantly and dramatically due to these breakthroughs. And this is not science fiction, because it's actually happening today in a limited scale, but by 2040, it will be mainstream. $415 billion is the expected market in 2000, was the market in 2017. Nanotechnology. Again, this started 1986, not very long ago. By 2015, we had nanoparticles used in automobile and aircraft industry to produce parts. They're also used in textile, fabrics, accessories, packaging, coating, filters, and catalyzers. So materials, lubricants, plastics, etc., all are changing because we're changing the composition at nano level. By 2030, 2050, bio-based nanotechnology, that is the use of nanobots, will create entire vehicles and aircraft manufacturing based on nanoparticles. Transforming the future of business definitely will happen. We'll have lighter material, lighter craft, stain-resistant textile, cell-sized robots that can enter the human body and work at the cell level or sub-cell level to target disease, cancers, and improve treatment. This will have major implications on humans, industry, and it will be equivalent to the discovery and invention of penicillin and the transistor. Superconductivity is also a major thing happening in materials. That's why I mentioned materials twice at the beginning. Since the early 1900s, work has been done on materials to improve or reduce resistance to electricity or electrical current in materials. So imagine a conductive material with close to zero resistance. That will imply close to infinite current from a small voltage, which means less need for power with a huge output. So a small power plant would be able to power a city the size of Dubai, for example, small generator. In 2013, science has been able to produce superconductive material at the lower end of Earth temperatures. Further improvements are happening exponentially, and within the next few years, this could become a breakthrough equivalent to the discovery of electricity, changing the face of mankind, which also means that levitation, although it's becoming mainstream now, or becoming possible now, it will become mainstream in the future. Levitation, that means objects that float and move in multiple directions. Imagine the impact on MRI machinery, on robotics, and other things in healthcare. Imagine the impacts on drones, on transportation, and so on and so forth. So that's a major shift in mankind history. Changes are happening at a much faster pace. Conceptualization to commercialization time is being halved from 20 years in the past to 10 years now. So a concept we're talking about today will be commercial in 10 years' time instead of 20. Here, I'm just creating a few linkages as examples. Artificial intelligence, robotics, and nanotechnology. If we combine those together, they create shorter hospitalization time, they reduce pain and discomfort for patients, faster recovery time, smaller incisions, reduced blood loss, and minimal scarring. 693,000 robotic-assisted procedures were actually performed in 2017 in the United States. So here we're talking about robotic-assisted, so physicians using robots to improve accuracy, improve incision, smaller incisions, less suffering on the patient, and less pain. Artificial intelligence and digital imaging, imagine the difference between a physician looking at an MRI result or a PET scan result and trying to analyze it, or plan for radiology treatment on cancer, or an artificial intelligence diagnosis helping that physician to pinpoint small things that the physician may miss, or to look at trends of potential recurrence and try to fight them ahead of time, improving treatment significantly. Image reading time would be shortened by about 40%, and of course, its accuracy increased. Material science with 3D printing, biotechnology, can actually enable us to produce better material for implants. Back in the 1900s, human implants to replace bones, for example, used to be made of steel. Imagine heavy human part as you try to move, and the body rejection to that human part. 1940, titanium alloys. 1958, we started having bone cement to try to mimic the bone. 1969, we introduced ceramics, solid, more durable. 1999, we started working on nanocomposite, 3D scaffolds to help reconstruct bones. Going forward, imagine that combination with an accurate digital image of the original bone, with the DNA know-how of the structure of the bone. We can recreate not just a copy, but actually a replica of the actual bone itself, 3D printed in the operating theater or the clinic, and implanted in a human body. In 2014, the first skull implant happened, saving a 22-year-old life. A complete skull was recreated based on the original skull of that 22-year-old woman. So 3D printing will improve operation effectiveness, custom-made, to answer patients' specificity, as I said, for implants particularly. By 2030, 3D printed organs will be possible, such as livers, hearts, kidneys, and will eliminate organ donation waiting lists, which is a major problem worldwide, let alone in this part of the world. Combining information technology and artificial intelligence will help us analyze large amounts of data. 80% of the work done on genomics was facilitated by big data analysis, looking at all sequencing and correlations between genetic structure and disease, which enabled a big leap in that science over the last 10 years. In 2017, a patient was treated for a rare form of leukemia by the University of Tokyo. The suggestion was made by a cognitive supercomputer within 10 minutes and by scouring 20 million cancer research writings. That's basically where artificial intelligence and technology is assisting in analyzing disease and diagnosis. So genomics and artificial intelligence help diagnose problems, pinpoint exact causes and treatments. Digital imaging gives us a better look at multiple layers inside the human body. We can replicate through 3D printing what the digital image has produced to a very high accuracy by using advanced materials that could replicate the actual tissue, human tissue being replaced, and conduct robotic surgeries to an extremely high degree of accuracy, assisting physicians in improving recovery time and better operation results. That means we need to improve technology know-how within the healthcare professional body, medical knowledge also among technicians and engineers. So we need to produce engineers that have medical knowledge and physicians that understand technology. We also need to make sure they have the skill in being able to work in multidisciplinary teams, whereby technologists and physicians and medical professionals have to work together, understand each other in order to produce results. And this is also a big implications on organizations. Organizations in healthcare being able to understand very well the use of technology and invest in it, and also telecom operators as well as technology companies understanding the full potential of healthcare and being able to create and operate within that environment in collaboration. If that is done, we have a great technology and science potential in healthcare, both combined. Demographics and accessibility to care will increase the scale of both industries significantly. So this is the next leap of growth in technology, in the technology space, in communications, as well as medical sciences. The rising need of healthcare, all of these combined, the longer lives, the better lifestyle, all of these will make fantastic investment opportunities in this converged field. So it's food for thought for all technology organizations to start planning their investments in that direction, and all healthcare professionals and organizations to take technology and embrace it further as it accelerates in its growth. That's one thought, particularly for telecoms operators when they're looking for their next growth area. Thank you.